I want to hear everything you got to say. You were saying you got a new one coming out?
Yeah, I think we're gonna do. I think my next one will do is like hormesis. Have you heard like the concept of like hormesis from that side of things?
Hermesis, Carmesis, Hermesis,
Hormesis. So in the sense of
Hormesis.
when everybody was asking about from the perspective of like hot and cold exposure. So how I explained it to patients is think about like when Sammy was talking about Tartaria, like old kings used to drink small doses of poison. So they could, if they got poison, they might
It
not
would be
die.
ready.
Yeah. So think about kind of the
Mm.
biggest loss with like COVID right now. And when I talk with patients is like, we have to find a way to actually literally stress our systems and create exposures. So hot exposure, cold exposure, breath holding work,
Right.
any type of that. And like, that's kind of the next talk is like expanding that hermetic window or distress and eustress training.
Would you say that that's kind of teaching the body how to best tolerate a CO2 threshold so that that
Yeah.
way it doesn't have, a negative response to the deficit of oxygen?
For honestly, so the big thing I talk about is we talk so much about oxygen, but when we start looking into what's called the Bohr effect, so the Bohr effect is just disassociation of oxygen through our bloodstream at the capillary to venous level. A lot of the times it's the inability to tolerate that CO2 that we just shuttle oxygen through. We don't disassociate or unbind that oxygen. So that's why we see the shallow breathing where people are like, I still feel breathless. My blood oxygen's low. So that ability to Stanford. So Dr. Huberman, who's on my acknowledgement, talks a lot about buteyko type breathing and the ability to increase our breath hold test. And that's one of the things I think can be great for like some of our app moving forward is even doing a breath hold test. And they're using that as a seventh vital sign. So like we have
That's
blood
amazing.
pressure, like we have all these, but like the ability to take an exhale and hold your breath for at minimum 40 seconds has
Right.
been shown to be a high level of low sympathetic system activity. So a lot of these people that you see end up with like 10, 20-second breath holds. So like it's such a beautiful thing with breath work and heat exposure in a variety of ways, cold
I
exposure. So that's my the next one I got
love
me
it.
thinking. So I think that would be a good one where people are like, how do I
Yeah.
actually do it? And
It's
like,
something so natural and needed. And I think you're just reminding, the people at home that it's like sleep is good, but have you ever thought about your oxygen
yeah,
thresholds?
that's
Yeah.
literally why my company that I started is called The Pursuit, because it's never an end goal. We're always in the pursuit of something that we're trying to achieve. And that's what we're trying to do with health.
Yes, sir.
There's really no, the biggest thing that I struggled with in school was there's supposed to be an arbitrary end goal, but there's really no arbitrary end goal in life. Like we always talk about ascension, we talk about the next step. That's what the pursuit stands for. It just happens to be outdoor performance, but really it's just the pursuit of what your goal is and
Wow.
understanding the process over what the end product is. Because that's another talk in itself is just how do we fix this dopamine freaking dysregulation we have right now in society? Like dopamine right now is probably the most abused drug in the world based off of what we talked about before,
Yeah.
social media, pornography, quick fixes, like all these things with,
Selfies.
yeah, seriously, because the cool thing about like old photos, think about this that we never think about. You had to do all this work to get a photo and then
Right.
you got something afterwards. You had to print it, you had to wait
And it was
for it.
private.
Yeah. So think about that. Like dopamine is just spiked because you get it instantly. And
Yeah.
we don't have an ability we have to have a dopamine release with hard work, delayed gratification, and then a super cool end result that leads into something that's was either learning or an experience. But a lot of times now there's no experience. Like you said, it's just click onto the next, click onto the
Yeah.
next, click onto the next.
Would you
So
say that it's kind of like a responsibility in order to improve health, not only to discuss these things that you really just brought up, but it's also to get people to understand the endorphin or the dopamine kind of
yep.
satisfaction,
Yeah,
right?
and
Way
it's the
different.
biggest thing. And that's the biggest thing is really the crazy thing is when you look at addiction, like it's just fixing and changing addictive habits to more healthy addicting habits. There is a reason why alcoholics and drug addicts all of a sudden go into marathons and ultra marathons.
Right.
We can debate if that's healthy or not, but it takes them out of things that are affecting their system and things of that nature. So um,
100%.
that's the
And
big thing. I'm going to share my screen here too to make sure that
let
we
me
can
go
kind
ahead
of.
and give you permission. I'm so sorry.
Oh
We
yeah,
got
no, you're
caught
good.
talking. What's up, Sean? Hi, Harley. Welcome. Glad you guys could join us.
Yo,
Boys, I'm excited. We're gonna have some fun tonight. This is gonna be great. I was telling Johnny, like, this is how you know you love it is when you got 10 hours treating patients and then you get to come out and talk shop about sleep.
That's right. You're obsessed with it. You're gonna
Oh
go to
yeah.
sleep soon, but not
Let me
before you give us this knowledge.
Let me see. Is there a screen share, Johnny, where I can share my face in the corner and then slide wise? I don't know from that side if that will work.
I can see your face.
Okay.
I can see the screen.
Okay. And I'm going to make this bigger then. Boom. It's fine. All right. Let's get this off. We're going to make this nice and big. Let me see.
All right, hey, I'm eating dinner, so I'm gonna put it on mute and let y'all bang out.
Dude, I'm just going to be going right in about 10 seconds once I get it up. So
Thanks for
Johnny's
joining
just
us,
gonna-
Sean. And by the way, congratulations, both of you gentlemen, on everything going on XT Crystals. It's been so exciting to watch.
Yeah, dudes, congrats.
I can, man, it's so dope.
Bro, it's becoming more epic every day. I mean, yeah, I'm definitely excited on where we're at, where we're going, and the full potential of it. It's yeah, dude, it's pretty wild.
Well, that's obviously it's all due to your hard work, and more importantly, things like this, where as a community, you guys continue to show up. So thank you for that, because it really is, regardless of how many, it's more about, can we support those in the community, because we all got something to say. And I know Eric's been preparing for this, and this presentation is phenomenal. He brings up a perspective that I wasn't really exposed to, and therefore I just can't wait to hear where his thoughts take us, and hopefully my brain can reconnect some information better. So all you, Eric, Dr. Krueger, please take it away.
I had to laugh at the comment of I think Harley liked it, of Freddie. I had to joke, that was, so I played baseball up until college, and that was half of my nicknames were just Freddie Krueger on that side. So I laughed when I saw that comment. I'm like, that's too good. But on to the good stuff. So welcome everyone that's listening in here or in the recording. My name is Dr. Eric Krieger. I work out of an outpatient sports and orthopedic clinic and physical therapy setting. I run my own business, which is at the bottom, the Pursuit Outdoor Performance. And I'm also doing medical advising with Health Bank Dow. Shout out to Johnny, shout out to Sammy. Like, I got my workout in today as well. So everybody that's listening to this, everybody in this call has to still do all the workouts, not just people that signed up. Myself, Sean's doing it, Harley's doing it, I know Johnny's doing it. So anybody that hears this, ask about Health Bank Dow. It's going to be a great game changer. So little background on myself. Like I said, I've been practicing health and fitness since I was 11 or 12. I'm 30 now. I'm getting old. I've been 3 years in practicing physical therapy. I got my doctorate at Mayo Clinic in Rochester, Minnesota. Prior to that, I was a strength coach for about 8 years. I did some internships with military special operations. I was at Mayo Clinic Square. We were fortunate to work with the Minnesota Lynx, which is the WNBA basketball team, as well as high school performance, which has been a blessing. They teach me so much every day. They keep me on my toes. But we're here for the big thing, which is sleep. But before I go into that, I have some credits and acknowledgements. Most of the information that I'm bringing to you guys is from these sources. You can always reach out to me if you have questions about these sources. They have taught me so much in the importance of sleep. We're going to talk about why it's a game changer in performance, why it's a game changer in health, why it's going to be a game changer in changing Alzheimer's disease as well as Parkinson's. But I have to give credit where credit is due, because you're only going off the people that challenge you and challenge you to grow. But into the meat and potatoes of the talk today. Why do we care about sleep? Well, I pulled myself as an example, and also pulled a lot of people in the clinic. And it's really scary that 80% of our population, this is from the United States, they struggle with sleep at least one night per week. And that means sleep disturbances or just waking up frequently throughout the night. Another scary fact is 3 out of 10 are using sleeping pills or some type of sleep aid. And that can be Ambien is a big one, which many people in here probably know. Ambien has caused a lot of things like night terrors. It's caused people to drive without knowing that they were driving. It's caused people to walk around their home without knowing they're walking around their home. Like, you're not sleeping at that point. You're just in a coma. So that's a big difference in what kind of really brought me to starting to question, like, why don't we sleep? Or why are people having trouble sleeping? Because we've done it evolutionary. And the cool thing about that is it's the only time in our lives where We're not awake to defend ourselves. We're not awake to the world, yet it's been an important part of our evolutionary process. So that's telling me it's got to be pretty important if we're going to allow ourselves to be defenseless for 6 to 8 hours a night. So one of the biggest things that I see in clinic is maybe even if they're not sleeping well, it's these individuals that come in and they're like, man, I just feel like I'm not performing at my best. I feel groggy. I feel foggy. I feel like I can't finish the day well. I have headaches. I'm irritable. And that's just a sign of chronic undersleeping. It's a very important thing to differentiate, which we'll talk about a little bit later, the differences in sleepiness, brain fogginess, and then just having a full-on sleep disorder. We're going to go through all that, but we need the basics so we can really hammer through why it is important to emphasize sleep. So this is one of my favorites. We all think that I just sleep, I lay down and I go to bed. But the cool thing that we're going to really kind of tear apart today, and I urge anybody on this call, if you have a question at any time, please stop me and I can clarify or answer any questions that you have. But our three big mechanisms for optimal sleep are going to be sleep pressure systems, circadian timing, and balanced arousal systems. When we're losing one of those three things, we're not optimizing both our understanding and our ability to fall asleep and stay asleep. So what do each one of those mean? This is a really cool picture for me, and we can talk about each part of it, which is the first part of sleep pressure. It's a big reason why we feel sleepy, and also why some people feel more sleepy during the middle of the day. So one of the biggest drivers of sleep is adenosine levels. All adenosine does is it ramps up throughout our day, whether that's going to be right when we wake up or a little bit after, and then it's going to go down when we sleep. That's kind of that circadian timing as well. So the biggest thing that I notice and we're going to talk about is how are we going to optimize that sleep drive level to drive it as high as we can throughout our day? And how do we also maximize our alertness earlier in the day, but then push that wake drive cycle down a little bit more? Some of these things that are going to be talked about are going to be caffeine, our genetic chronotype, as well as just what we're doing from a light timing perspective to better set up our mornings and our evenings to then get that optimized sleep system. Second is going to be circadian timing. This to me is one of the most important things, if you can take away from this, this talk tonight, is we all follow 24-hour cycles. In German, that is a Zeitgeist. A Zeitgeist is just telling us that everything in our body has a clock. They're natural processes and most primarily respond to light and in food. They're super important for releasing hormones, our eating habits and digestion, and also our body temperature throughout the day. The biggest thing for this, though, is if we can time this right, and we'll talk about this later in the talk, is it really sets up how we pattern our sleep. Because sleep is going to drive from habits, thoughts, and beliefs. The third big point that I love, and this is where my practice comes in, is a balanced arousal system. All that means is that our autonomic nervous system, which is a fancy term for our sympathetic response, which you probably heard in school, the fight or flight system, or the parasympathetic system, the rest and digest system, how are they balanced? A lot of people, through excess stress, poor diets, the lack of sleep itself, incompatible training habits, are in a constant state of high arousal. What that means is they usually come to myself, they come to Johnny, they come to anybody in these groups that they're anxious, they can't seem to shut down. Their thoughts are going to kind of race throughout the night. That's telling me right away that their arousal system, think of that switch on the left, is turned just too high. And there's many strategies that we can talk about that we're going to allow people to turn that arousal spectrum up when they need to. So in the sense of, if you're at work, you need to be on a higher level of arousal. If you're working out, we need to be at a higher level of arousal. But when you're home with your kids, or you're getting ready for bed, or you're sleeping, we also got to give individuals strategies to turn that arousal spectrum back down. That is going to be a big key for helping people learn how to shift their biology to be ready when they need to be ready, but also be able to rest when they need to rest. So this is getting into some big things that I like for people to kind of screen for and give you guys some information on. So big things that we need to understand is types of sleep disturbances. So big one that we look at is a secondary insomnia. All that means is that it's a direct result or symptom of something else. So a health condition, medication, pain, substance abuse. These are things that I can't treat in clinic, and I need to call in other colleagues that can manage it. So a big example I use is depression can be an underlying cause for insomnia. That's a referral out to a psychologist. We can still work with that individual, but I'm not going to be looking at doing something that's going to directly change that. The primary on insomnia is it's the exact opposite. Your trouble sleeping is not directly related to something that's causing from an underlying issue. Some of the small subsets of that could be an acute insomnia. The biggest ones that I talk about with patients is, you could be in a new place, you're adjusting to an environment. That means you might not sleep well in the short term, but that's usually can last 1 week up to a month, but usually no more. It goes away as your body adapts. Chronic insomnia is that symptomatic long-term response where we talked about people are having trouble staying asleep or not being able to fall asleep at least 1 to 2, if not 3 nights per week for a month or more. So again, these subcategories, I leave these more as if you need to kind of look at kind of things that you might have been dealing with to kind of put yourself into categories. It's not something that, you have to label yourself as, but it might help you understand, there's some things that are temporary and there's some things that are chronic that we might need to seek out other solutions with myself or other healthcare providers. So again, I always throw short-term in there. These are some of the biggest ones that I see with individuals. We talk a lot more on the belief system of that. So one of the biggest things we'll talk about as we move forward is your thoughts and behaviors can drive a lot of this short-term based insomnia. So biggest ones that I can see are jet lag, short-term illnesses. I work a lot with shifts at work. So night shifts like 7 p.m. to 7 a.m.s, but then trying to sleep during the day, as well as significant stress. But the beauty of these is through education, they're usually resolving once the stressors decrease or are gone. Chronic insomnia is kind of one of the tougher things to deal with because we have to kind of tease out a lot of factors within it. Those are going to be those chronic stressed individuals, depressed, chronic pain, which is what I deal with in clinic a lot. There can be circadian rhythm disorders. So think that sleep-wake cycle or the sleep pressure system we talked about, where we might have a mismatch in where that timing of that sleep pressure occurs, as well as chronic substance abuse. So this is kind of getting to into the weeds a little bit more, but some of the biggest causes of sleep issues, again, it's meeting in the middle, is there's perpetuating factors. So one of my big things in identifying people is what are their thoughts around sleep? How do they perceive their sleep? What behaviors are they current doing? And habits wise, most people don't have habits. And that's going to be a big factor that we talk about is how do we create small habits that build on themselves over time that allow us to build sleep pressure, as well as reinsure that we have proper circadian rhythm timing. There can also be precipitating factors that we talked about. So new jobs, traumas, periods of stress, as well as predisposing factors. So there's individuals that have a low stress tolerance or just have higher anxiety in general. By taking all three of these together, there's usually when people have sleep issues, there's some form of factor in all three. And when we can understand those, we can make better choices in our interventions. Because everything we talk about today, we don't have to do them all at once. It's overwhelming for people if we do them all at once. But we need to find that 1 or 2 habits that we could start with tonight, tomorrow, that they can build on over the coming days, weeks, and months. That makes it sustainable for them in the long run. So I like to think in a lot of what are our lowest hanging fruit and then what is kind of getting into the weeds. And that's kind of the biggest thing I learned from the online sleep coach course that I took. And the biggest thing we took away is how do we sleep better without making major lifestyle changes? The biggest issue we run into as healthcare professionals is a lot of individuals that come to us don't know where to start, but then once they start, they get overwhelmed because it feels like it's too large of a change in their life. So for me, the biggest and easiest starting point is those behaviors, those thoughts, those perceptions, those habits that we're going to talk about, and their emotions. If we can start that as our base, it allows us to work our way up to things like circadian rhythm entrainment. All that means is working on the timing of that circadian rhythm with light with temperature, with food and exercise, and then kind of working our way up into stress management and lifestyle. But we have to pick and choose with each individual through proper screening, as well as learning the psychology of that individual to understand where to start. This one, it's busier slides than I like, but all this is telling individuals is we talk about just sleeping better. And when people tell me, oh, you just need to sleep better, I feel bad for them, but also that they don't realize all the underlying things that could be happening. And all those underlying things aren't to say that there's too much that we can do to help that person, but understanding that there's nuance when we work with an individual on their sleep is going to be the biggest thing. And again, this is that same triangle or pyramid, just condensed the opposite way. So some big things that we talk about is the behaviors of our first one, our negative thoughts. How confident are we in sleeping? It seems really weird to talk about your confidence of sleeping, but an example I use when I ask people that they say that they're awake during the night, we come to find out that they're just actually in the light phase of a sleep cycle. So the biggest thing that we ask them is, do you remember, looking around your room or doing this? And more than likely they say that they don't. So their biggest thought is, I didn't sleep well, but in reality, they were just in the light phase of a sleep cycle. And that really that thought or that emotion is what's driving potentially more perpetual sleep issues. So working on some of those ability to understand where they're at in their sleep cycle can also be a big way from the behavior side. These are the big things that I love. The reason being is they're things that mostly are free. They don't require a lot of equipment. They can be tracked, and they also allow us to monitor which category they want to start with, because each one of these is separate in their own right, but each person feels better starting with a different category, but it's still going to move them along in their journey of sleeping better. So this was a game changer for me. It was brought up to me by Dr. Michael Bruce. I put at the bottom, I've used this before. It's how to find your sleep chronotype or your genetic chronotype. So I would highly recommend, before I go any farther, to go to the powerofwhenquiz.com. So all this means is it's your body's natural disposition to be awake or asleep at a certain time. The cool thing about chronotypes is they're closely related to your body's circadian rhythm, but they're also genetic in components. So that means you might be wired when somebody says they're, a night owl versus I'm an early morning person. They're finding in the research that that's truly a thing, and it's called that genetic chronotype. The biggest thing that I talk with people about is if we can identify that, we can come up with strategies and solutions to work with your chronotype rather than against it. Because there's a lot of times there's blanket statements on, hey, sleep better with this. Well, if your chronotype says you're more of a morning person and you try to do some things that are maybe more related to staying up maybe a little later to change that, that might not be just genetically wired with how you are. So I highly recommend, it's a free quiz. Go to the powerofwhenquiz.com and figure out your chronotype. We're going to talk about each one, but once you know, we can kind of tailor some of these things to each person a little bit better. So the first one, they're in animals. That's just the easiest way that we describe them, which is called the lion chronotype. This is between 15 and 20% of the population. They hardly ever nap. They're most alert during that middle part of the day, noon, 1 o'clock, 2 o'clock. They usually go to bed earlier. They're a type A. There's a lot of us in that health field that are similar to this. They wake up early and they're productive in the morning. So knowing this is kind of that first starting point of what can we do for those individuals? It's one of my favorite things is instead of forcing somebody into certain categories, we can give recommendations. So this is actually roughly my schedule. Actually, I found out I was a lion chronotype. I'm in bed by 9. I'm up most days by 4:45 or 5. I time my coffee a little bit later, which we'll talk about. Some days I do time restricted eating. I don't always do that, just because I found for myself that I do better on a more consistent eating schedule, and then fasting once or twice a week for 24 hours. So this is a really good schedule that people can use as a starting point for setting up their day if they end up being a lion chronotype. The bear, this is kind of cool because it's about 50% of the population. They're more than likely more productive kind of the middle of the day to noon, afternoon. So setting up their day from like 8 to 9 a.m. to noon for some of their deeper work. So the biggest thing that I like from busy professionals, or if I talk with them, is that's the biggest thing that you can find out if you want to be productive in your day. Understanding your chronotype allows you to know when you're most alert, and that allows you to create the deepest work at that time period. But it also helps explain when we start talking about different times of bed, why it's important to set up those routines along that end. So again, they're a little later actually. So they're more likely somebody that's going to bed at 10, 11 p.m., waking up again 5 to 7 a.m. But like I said, my work time is a little bit later. Theirs is kind of that 7 a.m. to noon. Again, each one of these are going to have all the components that we're going to talk about. So their ideal exercise time, which is between 3 and 5, so right after work. If necessary, a nap between 1 and 2, and time restricted eating. That can be a big part that's helpful for people, 1, to lose weight, but 2, they found that having some of that time restriction can be helpful for not digesting right when you go to bed, or as well as kind of allowing that digestive system to take some rest during the day. So the wolf is interesting. This is kind of some of those night owls when you see people like, I'm not productive in the morning. I like to stay up late. I'm much more productive in the evening. They're actually more alert around that 6 to 9 p.m. at night versus the day. They're usually more emotional. So this is where we start to see that shift. This is somebody that actually might be better off going to bed at midnight and working later or waking up later in the day. The beauty of this is when you work with people that are working remotely now, it can better shift their schedules so they're more productive at work, but also more in line with better sleep, because if they were forced into a 9 to 5 like we were even 10 years ago, these were the people that were told they weren't productive at work, but that wasn't the big reason. It was they were just not in line with their sleep chronotype or what their genetic predisposition for ideal sleep cycles were, which for them was more of a midnight to 9 a.m. or 8 a.m. So the beauty of this is once you can understand that, you can start setting up your days, whether it's a habit block or just even starting with bedtime, to something that's more amenable to you, and you're going to be a little bit more productive as we go. Last one, this one's a tough one. It's a very small percentage of the population. They're ones that have kind of difficulty staying asleep and falling asleep. They're super light sleepers. They have that irregularity. So this is a person, if you can identify them, that more than likely is going to need really, really strong habits, and they're going to have less room for error than the other 3 in the sense of fluctuating their habits. Again, they're going to be somebody that needs more stimulus control. So when we talked about a highly stressed, highly anxious individual, they need really consistent times for when they wake. They need really consistent times when they work. And they need to have a longer relaxation and downwinding time, in the sense of giving them almost an hour and a half to 2 hours to wind down, control their stimulus, and then go to bed. So that's kind of the biggest overview. Anybody on this call have any big questions of kind of that background side before we dive into some of the recommendations?
Yo, I gotta say, this is phenomenal stuff, Eric. Thank you so much for being able to walk us through these chronotypes. I'm enjoying it. I like where you're going with it, and more importantly, I just can't wait to apply some of these tips, man. This is phenomenal.
Yeah, no, that's so super appreciated. Like I said, the beauty of this is it's creating a category and a hierarchy of choosing your own adventure. I think a lot of the times, whether it's exercise or with nutrition or sleep, we say you have to do it one way, shape, or form. And all of these things, I encourage everybody, maybe pick one thing. And if that one thing, which we're going to talk about here, is light exposure or sleep wake timing, start with that for 2 weeks. Give it some time to see how you adjust, how you adapt. And if that is a good habit for you, then add the next one. So the big thing that we're going to talk about, and this is probably one of my favorite slides, because light exposure and sleep wake timing, they do not cost you anything. They're free. We just go out in the sun. You turn off your lights at night. Those are the biggest things. If I can recommend a starting point for somebody, is 15 to 30 minutes of daylight, morning sun without sunglasses. Contacts and regular glasses like I have are fine. getting that on your eyes. Obviously, don't look into the sun, but just that morning light exposure is going to be a big thing for setting that circadian timing. What that means is it's the signal for your brain and your body to downregulate that melatonin and that serotonin that you had at night and start upregulating cortisol. So everybody talks about cortisol being bad, but improperly timed cortisol is the bad thing. Most of the time when somebody wakes up at night or has trouble falling asleep, it's that improperly timed cortisol cycle that is driving or perpetuating that cycle. Another option you can choose is reducing and dimming lights 2 hours before bed. I have red lamps, and I didn't tell Johnny, but I have a free sleep accessory just sheet that I give patients and clients that if anybody wants it, I can include it after the talk. I use a red light glasses on my glasses. I use red lamps because it's a less spectrum inducing light than blue light is. Blue light's telling your body, hey, I should be awake. Whereas a red light that has lower wavelengths of light, it's going to be a little bit easier to read and still do things. Another big one that may cost a little bit is ensuring complete darkness of your bedroom. If light's leaking in, it's telling your body I should be awake. So options that can be there are going to be blackout shades. They're going to be a sleep mask. I use a sleep mask. It ensures that it's completely dark and I can't see anything. Again, I use another 15 to 30 minutes of sunlight exposure, both in the middle of your day. So with my work clients, that's, hey, go out for a walk at lunch. And then at the end of the day, as that sun is going down, get another 15 minutes. That's signaling the opposite of what we talked about in the morning. So if we're getting 15 minutes of sunlight as the sun's going down, that's that same zeitgeist cue that, hey, the sun's going down. We need to start producing some of that serotonin, that melatonin, all of those sleep chemicals to start setting you up for it. But the big key then is no blue light 1 hour before bed. That blue light is going to disrupt that cycle we just talked about of that sun going down. It's telling your body, hey, I need to be awake. Some strategies that we can talk about, and if people have questions, I use f.lux. I use that on my computer. It simulates some red light, so it allows you to work later into the night if you don't have a choice, as well as I can make a video that how I can alter the settings on my phone to go a dim screen with a red light background as well. The other side is that same sleep-wake timing. So the biggest thing that people struggle with is they get up, let's say 6 a.m. during the week, but hey, I want to go out and I want to party. I want to do all these things. And I sleep until 10 on Saturday, sleep until 9 a.m., 10 a.m. on Sunday. But then I got to get back up at 6 a.m. on Monday. So what we did is we shifted our sleep cycle a little bit later. We have trouble falling asleep. And then we also have trouble waking. So the biggest thing that I talk with people, and this is not hard and fast rules, but minimizing your fluctuation between 30 and 90 minutes of waking. So if you wake up at 6 a.m. and you want to sleep in, no later than 7:30. That allows us to still not get too far out of our current accustomed habit of when we wake, but it still allows you to sleep in a little bit. So the other big thing that I look at is write down, it seems silly, but another option is writing down your bed and your wake time. I tell people I'm in bed 9 to 9:30. I'm up 4:45 to 5:15. I don't have hard and fast rules, but I know that if I'm going to be in there, that sets that body up to know, hey, it's time to start winding down, because that behavior is what's going to drive that change. So the beauty of this too is with Health Bank, we have activities that we can do anytime during the day. And the beauty of the exercise isn't the type of exercise we're doing, it's the timing of when we're going to do that exercise. So the biggest thing that I look at is, again, consistency of that exercise schedule. If you know your chronotype, you can go back to those previous slides now that it's recording and find that optimal window for exercise. I'm much more of an exerciser in the morning, so I don't have a choice. I have most of the stuff like this where I'm giving talks or I'm finishing up notes. So I have to work out in the morning. So I'm not as consistent with this one. The biggest thing they found is at least ensuring 3 hours between exercise and bedtime, because we're still driving a lot of those endorphins as well as cortisol again. So we need that ability to come back down prior to sleep as well. But most of the time, if we have a moderate intensity exercise, especially if we didn't sleep well the day before, we can use that as a sleep aid as well. So again, I talked about this briefly, the nutrition side of things. I'm not a dietitian. I can use habits to help change those. But again, it's going to come down to consistency of when we eat. Again, I have found that daily intermittent fasting doesn't work well for me. So they've talked about time restricted eating. But it can be helpful for people, one, for weight loss, but they have found some potential things in research that a time restricted window, 10 hours or less usually, can be helpful with that same amount of timing like we have with our sleep. But ideally, again, like exercise, we end that food window 2 to 3 hours before bed. So we're not trying to digest, because that's a big one that I see with people. Sometimes they eat immediately before they go to bed. And then they're trying to digest when they sleep. So sometimes the issue isn't a sleep issue. It's a timing of food where they're still digesting food and their body doesn't want to get into that rest mode at this time. This is usually one of the biggest ones that I start people with, only because I've seen how powerful it can be. Most of my day, I have what's called an Euler. So an Euler just chills your bed. It goes between 58 and like 90 degrees. But they found through some of the research on individuals about 60 to 67 degrees for sleep onset, and then maintaining that during the night is it was kind of what they found in our evolutionary development was a good temperature to sleep in. But one of the things that I recommend for people is if you feel like that's too cold, just use something that transitions you about 3 hours before bed. So you can set that thermostat at 72, 73 and get it down to 68 over 1 to 3 hours, because that's the same thing as when the sun's going down. We get a transition from a higher temperature setting to a lower temperature setting, which is signaling our body to start shifting into that sleep hormone producing phase of our night. So again, there's a lot in there. We went over a lot, but I think it's important to understand that we can choose any of those habits and we can roll with it. Again, these are references that I've used. So a lot of those slides were from Nick Lamb's course. He graciously allows individuals after you completed the course to use the infographics. Why We Sleep is a great book. I'd highly recommend it to everybody in this group and anybody listening to this recording. Dr. Matthew Walker's brilliant. Dr. Michael Bruce is the individual I found the Power of When quiz. And then Dr. Mike T. Nelson, he's a mentor of mine. He's actually in Minnesota. He's one of the smartest individuals I know, and he's really challenges my thought process of understanding any type of exercise, nutrition, and sleep. So big things. Again, I want to thank everyone for their time. I know it's 6:30 on a Tuesday, but I believe this stuff is super important. It's more actionable than we think to create changes, and the changes can be done pretty quickly if we identify where people can stick with these habits. I threw my contact information up there. This is my personal cell. If you have questions, that's my personal email, and then my website. Like I said, that's the Pursuit Outdoor Performance. I'm fortunate to work with clients remotely, whether it's injury-related issues, sleep-related issues, or just performance improvement issues, as well as working with Health Bank. So again, what's some big questions, guys? Do you have anything that's been itching at your brain? Do you want to know more about, that you want to delve into? Let's shoot.
I got to say, that was awesome, man. I am so happy I've been able to go ahead and take notes. I got a lot of questions, but I'm going to shut up so that everybody else can jump in. If you guys want to go ahead and unmute and join the conversation, this is the time. Dr. Krueger has delivered a fantastic seminar. So thank you so much for explaining to us these chronotypes. Let's see if anybody wants to tell us what type of chronotype they think they are.
Oh yeah, that'd be interesting. I'd love to hear that. Also, I know there was questions in the health support group. I can show you guys my sleep tape that I use, the mute nasal dilator. I can show you the light timing that I have, as well as the red light as well. We can get that on recording as well.
Well, since you actually went on this topic, while they go ahead and you know, recruit the courage to get on here, the green light therapy is actually one thing I'm really big fan of.
Yeah.
So to hear you speak on red light therapy was really refreshing. So
do
would
it.
you say that red light therapy would be ideal for like nighttime and kind of like bringing the senses down, kind of like the CNS, kind of cooling you down?
Exactly. That's the biggest thing. So like the ability to like it's really the structure and intensity of the light. So things like red, green, lavender. It's a reason why actually if you want to down regulate somebody's system, that muted colors feel more relaxing in a paint. So like a lot of therapy rooms are actually painted lavender or a light green or even like a light red to allow that. So it's just a lower spectrum intensity light that is in the stimulatory. So I use it all the time at night. There's been benefits they found with skin. So a lot of people use red light therapy from skin health. They've seen some promising research on joint health. Just focally putting light, usually I think 600-ish and then 880 nanometers. I'm not sure off the top of my head, but I think it's those two. It's a near infrared and then a far infrared. If individuals are looking for it. But yeah, that's spot on. From the CNS perspective, it allows us to again shift that arousal timer back down towards that parasympathetic end.
This is awesome, man. And obviously there's a lot that goes into what you just brought up because you know, I used to deal with a lot of clients that have sleep apnea.
Mhm.
And so usually the case is that when you're trying to help them, they kind of beat themselves up because they are immediately suffering from a lack of oxygen
Mhm.
inherently from just not knowing how to live because their rib cage and their breathing passageways are so constricted because of their poor sleeping and mobility.
Mhm.
And so now it's like the breathing girdle itself is not going to allow them to actually acquire as much oxygen as they may want, which then also affects their sleep performance already. So one of the things that you were talking about that I really enjoyed was kind of when you were talking about, let me go back up to my notes, the 3 Ps, right? The perpetuating factors, the precipitating factors, and the predisposing factors.
Yep.
I guess the way that I kind of understood that is that there are those things that are affecting you in the moment, which would be the perpetuating factors,
Yep.
your thoughts, as you mentioned, that like monkey mind. And then you also have those precipitating factors, I guess, it's the wear and tear of the day.
Yeah.
And sometimes we don't separate them because there's 3 parts to it, right? It's what you think in the moment, the wear and tear of the 24 hours, and what you've done your entire life up until that moment, which could be also the unspoken trauma that sometimes is a predisposing factor that if it's not addressed, you know, it just kind of keeps eating you up. And so I love the 3 Ps, man. I thought that was really, really clever.
The 3 Ps are such a great analogy that Nick brought up. And I think it's such a helpful way for people wading through what you just said, because a lot of people, one, are low on the ability for emotion processing and completing a cycle. I mean, I think that's a
Right.
big part of those things when you talk about unprocessed trauma, and why I feel like it's such an important to do things like Health Bank DAO or collaborate with other professionals, because it works really well. If I identify that and I know I can't treat unresolved trauma, I can send that to a really good psychologist that I trust. That doesn't mean that person leaves me. It allows them to work in conjunction and collaboratively so they can address one part that I can't treat. But I know that I can also work with my ENT when you talk about the sleep apneic issues. I can work on the habits that allow those individuals and their thoughts around the sleep. I can address those respiratory limitations. So we start talking about understanding full respiratory excursion and how the diaphragm influence can play a role in sleep apneic conditions, as well as when we talk about epiglottal closure, as well as airway and sinus issues.
Yes.
Those can all be addressed through the ENT and myself. I think that's such the big thing that I like to leave individuals that are trying to either get into blockchain or health, is we have to collaborate, because you have to have the pride to know what you can treat, but also the pride to know what you can't treat or need to collaboratively work with.
100%. And I think that that's why these spaces are so important. And it goes back to thanking you about being able to go ahead and step up and really say that even though you're working 10 hours serving the community, you're willing to have a little extra juice to give the community this type of knowledge that's really needed. And the discussion obviously in blockchain is not really had because everybody's thinking about, you know, how to maximize investments and profits and returns, but ultimately the sleep is the best investment.
Yeah.
And people not understanding a true sleep cycle leads to sleep inertia. And to me, that's the best way I kind of like always manage my sleep is I consider my sleep math daily. So it's kind of like if I didn't get my full 90 minutes of sleep, I don't have a full cycle.
Yep.
Right. And so those 90-minute cycles allow me to say, kind of like a washing machine. If I want to wash my brain out of all these aggregates that would essentially build up and I want to prevent, Alzheimer's, mental health issues,
Yep.
any kind of ailments, because one of the things that I think you brought up here with these type of personalities or, chromotypes of sleep is that there is that genetic chromotype versus the sleep chromotype versus the chromo exercise and then obviously the chromo nutrition. So would you say that ENT, as you just brought up, is a good what is ENT? I'm sorry.
Yeah. Oh, sorry. I should say that ear, nose, and throat. So I work closely with a dentist and an ENT. So when we talk about how do we truly, because that was just brought up from the sleep apneic side of things. So we have a couple things from the sleep apnea side when you asked about that.
Yes.
So there's a couple ways that I've seen people. The big one is usually epiglottal closure at night. So low tone in the larynx and the pharynx, and the epiglottis closes over, which is why you hear a snoring sound because they're literally choking themselves at night. A second avenue of sleep apnea can be a deviated septum. So a lot of people that I see had a car accident, they were in football, all these things, and they deviate a septum where they might need what's called a septuloplasty on that side, which is just literally opening that nasal cavity and allowing us to get air through so they can breathe through their nose, which, as we all know on here, is going to be a big factor in determining our health. So that's an ENT from that side.
That's so much more helpful. And you're totally right. Ears, nose, and throat. Obviously, it all goes down to, the neck mobility and kind of what these cell phones and computers have done to us is they put us in this position where the closed chest and really tightening up that, the muscles around the clavicle, limiting shoulder mobility. And this is why I love what Sammy is doing with this health challenge, asking everybody to use resistance bands and teaching them how to actually push outwards instead of just pushing and really being able to activate those stabilizers that would essentially allow them to readjust their skeletal frame. All of this, I think, combined with what you said, this knowledge of sleep is what we hope over the next few years can become the new standard of health. And it can only be done because of mentors like yourselves here on this podcast who are not only obviously trying to share it, are living it, but are applying all of these different practices. I have a big, list here of notes, man. I actually wanted to go back to one more. I just lost it while we were there. Do you actually use any green light therapy yourself?
Green light, I don't. I got to look more into that side of things. I know that was a big one that you mentioned, just because I have 10 plugins right now. It's literally the only reason that I don't have probably green light on that side of things. And I've heard great things about it, but I've just always steered towards red light because I can get it in a handheld device. And it's much more commercialized, and maybe there is some commercial availability of green light. I just haven't seen it as much.
No, that's exactly where I think I found the roadblock when I was doing my research and trying to acquire this was ultimately trying to rebuild an individual's pineal gland and kind of reset their circadian rhythm because essentially green light at the frequency or the intensity of the nanometers that it runs through around, I like to think of it as kind of like that. What is that? That 480 to that 580? Is that 600?
Yep. That's right in there. They actually make a device. I think I might have to send that to you. Ben Greenfield tested one where he had there's a light up his nose and in his ear.
Oh, wow.
Let me look.
It's something about dichromatic green that makes a big difference for the receptors of the eye. It's dichromatic. And if anybody really is interested, I think that there is a link. But, ultimately, I just found my notes. What I was going to address was, how do you feel about, a lifestyle that focuses on AMPK and mTOR cellular pathway activations in order to restore sleep pattern kind of performance?
I think that's a big thing. What big things do you do on your end to restore those things? Like from your examples, just so I can know.
Yeah, no, definitely. When I think of AMPK and mTOR cycles of cell way activation is just to
Yeah.
basically the way I sold myself on this was cellular longevity.
Yep.
Depends a lot on obviously the system, if the switch is up or down, on or off, as you were
Yep.
saying. And so being able to be that fight or flight or rest and digest became so important to me that it essentially it led not only to understanding what environments I expose myself to,
Okay.
not only what things I obviously look at or what thoughts I have, but ultimately is that movement can, in a way, affect cellular pathways so that it can have a stimulus on growth of cells. And the reason I say that is because with over excessive mTOR activation, we do seem to have the potential of maybe having more likelihood of having cancer.
Yep.
Right. And so this erratic kind of abnormal rapid cellular growth occurs because most people are living in that mTOR cell state.
Yep.
And so, as you mentioned, being able to implement these lifestyle patterns that allow you to kind of shut down the CNS to really go back to that rest and digest state where it's a kind of in that AMPK state.
Yep.
And ultimately what I found was really these supplements like teas, natural teas. And that's why I'm really happy Mr. T's on the call, because he would actually be the expert that would be able to kind of give us a little more as opposed to myself on this. But the ability to kind of really shut down the body with teas and getting those excess minerals. That's kind of how I like to shut down my body, and I like to wake up my body with some salts.
Love it.
So that way it's kind of like green light and ormus, monoatomic gold, any kind of magnesium, to really kind of give me that like cellular balance at the beginning of the day. So that should there be any stress throughout the day, the magnesium itself will be able to mitigate the effects of the stress. And I think that that's where a lot of people kind of fail as well, as your presentation explained, these different chromotypes of sleep and activity. Ultimately, we all handle stress differently. And that's really why I was just so kind of curious about your perspective about sirtuin activated diets, or more like, what do you have to think about that?
I guess from my end, I look at it from the ability to state shift. So I've looked at mTOR, I've looked at all these things. The one thing that I've learned from working, with some of the military side of things is the ability to state shift is going to be the biggest thing. Like you said, your buffers are going to be those magnesiums, your buffers are going to be things like cold water exposure, heat exposure, but some of the abilities that you can work into breath practice, self-hypnosis, NSDR are all going to be those things where we talk about that AMPK and that telomere remodeling on that side, because it's the ability to shift that state in the moment while also having long-term buffers. So like from my end with nutrition, I haven't looked too many into too many diets. I've really kind of focused in on what are our main tenets of a good nutritional practice, because the biggest thing that I run into working in with clinicians personally is we get so focused on some of the minutiae in diets that we're forgetting that most people aren't hitting their daily allotments of fruits. They're not hitting their daily allotments of protein. We're not getting people organ meats on that side of things. We're not getting people adequate amounts of salt, magnesium, creatine, all these things. So for me, if I can check those boxes, I really truly haven't looked into too many diets. It's like, how do we fit those basic things that we just talked about around your lifestyle? Because like you said, we're super low in magnesium due to soil deficiency on that side of things. We know a creatine is good for health in the sense of muscle building, but I don't know if you guys know that, but they're having a ton of emerging research for Alzheimer's and Parkinson's on creatine stores and that helping restore kind of some of that brain activity, because your brain feeds on a lot of creatine as well. Higher salt diets. Again, anybody listening to this, a moderate amount of salt is actually really good for us. It helps decrease anxiety levels. Especially I use a Celtic sea salt or a Redmond sea salt on that side of things, because it's going to have micronutrients and microminerals. And that's just from personal experience. I have vitamin D. We're going to have just a good magnesium complex. I use anything that's not citrate, so you don't crap your guts out.
Right.
That's a big thing. But like from my end, like you said, I try to go from tenets of habits. But I do agree that some form of diet, whether it's the diet you spoke of or anything, has to be around something that's going to give you high protein sources, good amounts of saturated fats that are going to be from grass-fed sources, any types of fatty fish oils. That's going to be the big tenets, because like you said, we have to support mitochondrial health. We have to support membrane health from the cells. It's got to support our brain. Those are going to be the big ways that we can do that through a dietary intervention.
Man, you're hitting on a lot of things that I wish were more present in people's awareness of things, and going into these concepts of mitochondrial health.
Yep.
I keep going back to the idea of energy, because
Yep.
ATP, obviously, when you brought up creatine, essentially everybody's looking for a way to create energy more efficiently, but they forget that it's not about the creating energy, because this process does have, in a sense, not only its waste, in the sense of, if you happen to operate in a let's call it a glucose-based manner, you're going to have these free radical that's just remaining out there that you have to deal with in order to kind of negate the effects of eating these things. So would you say that in the practice that you're obviously you're experiencing your day-to-day kind of like clientele, are these individuals concerned at all about their brainwave pattern? Or do you think that they're just kind of always in beta and they're just being manipulated all day because they were never really able to kind of expand their awareness of what these brain cycles are and how they actually benefit the body?
I would say most people, when we talk about the ladders of awareness, so like, there are a lot of in the stage of like, they don't know what they don't even know. So really most people are kind of on that lower vibrational frequency realm of operation. But as healthcare providers, I think that's our role, is how do we shift them into that next level of consciousness? If I could leave one thing for healthcare professionals, and I had this talk today actually with 2 patients, is like, I'm not a fixer. I don't fix you. Like, there's nothing that I do that directly fixes you. Like, a healthcare professional is like, I love cartography. So like maps,
Right.
We're really the cartographer for a patient that walks in the door. So my goal is, hey, this is where you're at and this is what you don't know. We're going to draw that map so you can start moving towards that next ascended level, whether that is talking about brainwaves. But more than likely, if we can turn them on to that first habit that causes them to break that cycle and question things, we're going to already start that loop. And then as that map drawer, we have to draw the next object. It's like, hey, all of a sudden this rock came out of nowhere. Let's go around it. Let's figure out the best way to get there. Or a storm comes up. How do we weather that storm? My whole goal is, how do I take somebody that has lost that locus of control, because that's most people that come to the healthcare system, and regain that locus of control so they can start, one, fixing themselves with the tools that I'm going to help them find and that's sustainable for their health. And then 2, start to question a lot of the normal things, because as you know, and everybody in this group know, that if it truly was about fixing your health, we wouldn't need 17 pharmaceuticals. We know there's so many things that we can do that's free or in nature that helps people immensely, but that doesn't make money. I think that's the sad part of our healthcare system, is there's obviously needed times for that, but there's also a lot of times where people haven't had that ability to then call into question what they have learned or what they've thought, and being open-minded enough to try different things. And I think that's the biggest thing when people come in, is that brain frequency changes when I start to have what we call that behavioral change model. Everything that I tell somebody has to be of their own choice. It's kind of like Inception. You have to plant that idea into somebody's head and make them think that it was their idea. And that's the only way that you're going to have true and lasting behavior change to take them from that beta level up to that next level of brainwaves.
I couldn't agree more, man. And as I'm listening, it really does become clear, not only the huge task that you have in front of you, but how you're also approaching it with grace. And it's awesome to hear that, you focus on the total package, and you're more than prepared to handle, as you said, the process of drawing out the map towards each individual's custom path towards health. Because it really is one of those things that it cannot be a cookie cutter approach. And it's exciting to hear that you put so much passion into every person that you work with. So, you know, as I'm listening, I think that the people who might catch this recording will really benefit from things. I'm curious, man, do you have any kind of like final thoughts that you may want to kind of guarantee the people to kind of take away with?
Yeah, I mean, other big thing, this is just sleep related again. If you time your caffeine 90 to 120 minutes after waking instead of taking it right away, it's a big way that you can feel more energy throughout your day as well. So that comes back to that adenosine cycle that I wanted to throw in there. That's one of my favorite things that I use as a
Yes.
little hack too. So that's one there. But like I said, the biggest thing that, you know, I want to do, and I think that's the biggest thing for people is just get this information out. Like I said, I'm an open book. Everything I've learned from mentors, they've been gracious to share their time with me. So I'm the same with anybody that has questions, that whether they're a healthcare professional, especially looking to come into health bank, um, or looking just to kind of build up and learn more about themselves. So again, like I said, Johnny, I thank you for letting me have this time. Like it's not any small feat that I tell everybody that you're willing to come on at 6:30, you know, at night and do this. So again, thank you.
Man, we actually as a collective, we thank you for always bringing your most professional self, and more importantly, for being one of the first to really step up and join us on this mission to unite the world through health on the
Yeah.
blockchain. And you're a revolutionary who's really leading the way for other health professionals who, you know, at first may be curious about what we were doing, but if they were curious before, they're going to know soon. And if they don't know after this sleep seminar, they're going to have to slowly start to understand that there is a lot more depth to the ecosystem than just a fitness application. But obviously, it all starts with how do we allow others into the quote unquote organization? And the only way to do that is to take part in this health challenge where they can kind of not only challenge themselves, but connect with mentors like yourself, Mr. T, obviously all our other mental health coaches that we have available, professionals like Sammy and Janie who are ready to go ahead and create custom training programs. But the organization can only grow because of the effort and passion you guys put into it. So Eric, seriously, Dr. Krueger, thank you so much. It means the world to me. And I'm sure that everybody here that's listening, not only did they learn a lot, I got some great notes, and I'm super excited to share this with a couple of my clients from when I used to run my gym. I know a lot of them still deal with a lot of sleep apnea issues, and they're still kind of dealing with those, you can call them little voices in their head that sometimes get the best of them, right?
Yep.
What
And I
would
think
you
that, oh, sorry, what were you saying?
what would you say to those kind of people that still let the voice get to them? How do they shut that noise down?
Yeah, that's a great. So I found for me, I've used an app a little bit more now called Reverie. It's actually a self-hypnosis. And everybody thinks like hypnosis in the sense of like, you see like the sideshows or things like that, where people are doing, you know, they get hypnotized. But I've found it a great way because it creates an ability to center and look through visualization. So really, the gentleman who created it, I believe, is at Stanford as well, and he's very good at helping people center and be present. And I think that's the big thing that people struggle with is, to me, in the technological age that we have now, is we have so much information coming in, is we don't have time and understanding the ability, like Janie said during our health and wellness podcast, just to sit in thought.
Right.
Or they can use NSDR, which is, you know, non-sleep deep rest. I use that during the middle of my day to help, again, center and focus in on the present moment instead of thinking about those external factors. So I have like that same mantra of like, though I'm not, if I have tons of nights, like if I'm really stressed that I don't sleep well, I tell people all the time, like, it's normal that there's nights that we have sleep disturbances from time to time. Like we really feel like we failed. But there's times where I just use NSDR in the sense of allowing myself that though I may not be sleeping, I am resting. And they found that NSDR has been slowly able to produce periods of the deep sleep phase of the sleep cycle, even with 20 or 30 minutes of NSDR. So I use that a lot. And again, I think it's just setting up those habits and routines. Like if you have that ability to have habits and routines, you know, you can fall back on those things. And allows yourself to have confidence that you're doing the right things. Because I speak a lot in analogies because I think it makes more, is like sometimes in poker, like a lot of people play poker, you could have a pair of kings and be like, oh heck yeah, I'm gonna win this, you know, win this hand. and then all of a sudden you lose on the flop because a card came up. That doesn't mean the habits that you chose were the wrong habits. It just means the outcome was not what you expected. So that could be maybe the next night that outcome is different on the next deal.
I love that. And that you bring up a good point there. Obviously, you know, you mentioned you don't sometimes feel like you rest, but you found a way to kind of hack
Yep.
your body's kind of state. So let
Yep.
me go ahead and ask before I have two questions. Can you put up the name of the application? You said it was Bream, or what was it?
Reverie.
Reverie. Can you put that on the screen just so that
Yeah.
if anybody's watching, they can kind of,
Yeah, here.
I'm having a hard time visualizing that.
It might be easier if I might have to just throw it onto my, here, I'll just do this. I just want to see if that, I don't know. What I'll do is I'll post it to the group.
Of course, no worries.
It'll be easier. So
We'll add it.
anybody that wants to see Reverie has to join the group.
There we go. And I guess the second thing I guess I was gonna say is how often do you write? Are you you know, because you mentioned sometimes when you feel like you just don't know, you know, when you kind of feel like you failed, you kind of brought that up, and maybe I'm taking it out of context, but do you ever write to
Yeah,
kind of let your mind shut down through writing, and the form of writing allows your mind to rest better, to get better sleep?
So there's a couple ways that I do writing side of things. I have a gratitude journal where it's just like, what are the 3 things I'm thankful for every day? Just because as humans, we're so evolutionary wired to focus on bad things. Like
They're right.
really, like that's why we survived for so long, is we always know the negative outlook, and that's why we can predict the outcome, because we don't want to do it. So gratitude's a big one that I use from a thought perspective. Second one is just, again, at night, like the biggest thing, probably the clients you worked with are super type A. So I brain dump most nights any ideas and thoughts in my head. And then I always write at the bottom, like, you know, the work is done today. There's always more work to do tomorrow.
Right.
So that's kind of like that ending point. And the third one is just like general writing. So like this presentation or that hormesis talk that we've talked about, or
Right.
articulating thoughts that I have there. So I have a kind of a mix of 3. Short to long is kind of like the gratitude journal is just like 3 quick blurbs. That middle part is just kind of brain dumping at the end of the night. And then the third one is like long form educational stuff.
I love it. And it sounds like you have a really good relationship with self, which allows you to then be able to understand when it's time to shift states.
Yep.
And it just sounds like you have a great kind of awareness of what self wants, when self wants it. And you've empowered yourself, obviously, through practice and research and networking. And, you know, putting yourself out there, asking these mentors of yours kind of like, yo, challenge my perception of how the human body works.
Yeah.
And I think that that's what makes a human, you know, free and
Yeah.
sovereign. The fact
Yeah.
that they pursued other opinions about how others run their vehicles. So with everything you shared today, man, I feel super excited for others to keep picking your brain. And I'm more anxious about the next topic, man.
Yeah. Ask away. Like I said, any topic I can look into, but I would say, like, to go off what you just said, I think that's been the biggest change in the last year, is like the understanding your purpose helps so many things. Like I told you when we first connected, you know, it's been a while now, like, you know, equitable healthcare for all. Like, I think that's the biggest driver of everything I do, is like, nobody should be limited in their access to healthcare, especially high quality healthcare, just because you have a certain amount of money. There's other ways that we can earn money that aren't directly off the patient. Like you said, all the things that HealthMake are doing are allowing healthcare individuals to not have their sole source and income off the patient, off the individual on that side of things. And I think that's such a big thing. When you understand that, it drives the purpose of what are we actually trying to do.
100%. And I think that you just nailed it there, man. If we could find a way through, you know, I think Harley likes to call it friendly competition. And the way I see it is like, hey, I challenge you to see how many people you can heal. Ready, set, go. And let's see who can heal the most. And it's not about who does the most. It's about, did we heal? And it's that friendly competition, which is like, the more that you try to go ahead and heal people by sharing your perspective, there's healers that are doing it with only, you know, movement, but they overlook sleep. And so the moment this healer that only uses movement learns about the power of sleep and combines it, you know, because of a presentation like we just shared with us today, I think they're going to amplify their impact. And ultimately, that's where I think this whole thing is going to change into what's called a health revolution.
Yeah.
where
Well-
it's peer to peer. You teach me, you're the healer. You teach me, I'm going to go ahead and apply it. And then I'll come back and give you some feedback about how that worked for my people. And hopefully we can continue to improve it as we share it at the top of our lungs.
Yep. I think that's the biggest. And the one thing I've learned is, why I put myself out there for these things is like, you have a cap number of people you can help in clinic. I can help 8 to 10 people at a time throughout my day. Whereas as you put yourself up there and get challenged by others in theirs, is if they learn from you, like you just said, you're helping another 10, 50, 100 people. And then that Charlotte's Web starts kind of unfolding of, the thousands of people that you can help just based on helping other individuals or,
Yes.
the remote side as well.
One man, and that's the thing, by being able to go ahead and put yourself in this position where, and I read something that I've told myself in the past. I was looking through my old archived files, and it said, don't build with someone that you have to tell to go pick up the bricks. And it was that which just kind of reminded me of you and every single person here on this call. It's just, you don't build with people that need to be told how to help. They just got to go help, and they do it, and they know that they got to do it for themselves and their community, and they don't wait for a how, they just find a way. So thank you for making this possible.
Yeah.
I cannot wait for the next one. And I hope that if you guys are listening, please take the time to reach out to Eric. He's definitely going ahead and making sure that he's available to all you guys, not only as a friend, as a doctor, and as a mentor. So you'll be able to watch him grow as well as he's slowly learning how to build on Web3.
Yeah.
He's building not only his website from scratch, and he's done a wonderful job. And now, more importantly, he's transitioning on to the next phase, which is breaking down the ideas into what could potentially become an actual Web3 application that allows other healers to be able to do what they got to do to help others, but still be financially rewarded by their efforts. So Eric, seriously, Dr. Krueger, I keep messing it up and I apologize. Man, I look at you as such a good friend that I don't even think about the profession, but you're doing it with such class that seriously, anybody who's here listening, if you have any final thoughts, would you like to join us? Nani, Harley, Mr. T?
Hello.
Woo!
I'm coming to you from my bed, third day in COVID, so my throat's shocking. But very good topic for me right now. I'm sleeping a lot, but just not patterned. I just wanted to say much gratitude for your shares, and there's some new information there. Really curious about red light. I've actually had a red light in my bedroom for some time, but never tuned into why. So thank you. I'm going to read more about that.
Yeah.
And green light, Johnny. It's on my radar to look into too. In terms of my personal experience, many years ago, when I traveled through India, maybe I learned it before, but there was a saying of only the dead point their head to the north, and from there I became curious, and from a pole perspective and energy, I've never slept, and I'm in the south. I'm in Australia, so I've never slept with my head pointed towards the pole, mostly towards the equator. But still, I find personally there's an energy drain when I sleep with my head to the pole. Maybe it's my belief system, but yeah, I just thought I'd share that. I mean, there's many other things I've adopted, like yoga nidra and breath practice, which are great. But they all culminate to a better sleep pattern for me. Waking to the sun, love it. Oh, but anyway, I thought I'd share my 2 bits and just say much gratitude for your shares, and poking my curiosity on new things.
Yeah, no, like, thank you so much. I've seen some stuff on the polls. I'd have to reach out to a colleague of mine. He had a topic on it before. But I haven't dug too much into that one. But there has been some other things of like how you position your bed, whether it's kind of inclining your bed, declining your bed as well for drainage as well from like CSF and things of that nature. So I would be curious to see some more on that too.
Mm, mm. Yeah. I just go through lived experience nowadays,
Yeah.
but yeah. Yeah.
No, I think that's the best way. Like I tell everybody, most of this stuff I've done on myself, so I can explain how it feels. Like I don't think you should do many things in practice. Obviously, like movement related or sleep related, like you're not taking medications, and I can't prescribe those things. But unless you feel like what it feels like, because you can't have a shared experience with someone without, if you just tell them to do it and you have no context, then you don't know what the outcome is going to look like as well. So no, I think that's a great way to do it. Find what works for you. And if it works for you, stick with those things.
There are so many lessons in nature. It's just that some of them
Yeah.
you have to feel. We can't see them. Yeah.
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 I really, really like what you said though, Nani. Obviously, what you are discussing about the polls, it's funny because I've actually practiced that a lot when I was really getting into this whole idea of like why religious movements are so focused on the activation of either glutes or the curvature of the spine, and how we praise certain gods or certain ideas, and the way that we position our bodies are always kind of using these you could say the pole as a coordinate for kind of defining these kind of rituals. And it's really, really interesting because we often kind of position ourselves to where the sun is going, so that way our eyes can actually have this contrast of sunlight, so that way they're not basically exposed to this blue light, as he was saying. And so sometimes the lack of exposure to the contrasting light frequencies is actually what inhibits us, or doesn't let us sleep properly. And so I just don't know if that's something that you've also tried, in the sense of maximum sun exposure in the morning, midday, and nighttime, as Eric was saying, because that really was a game changer for me. But obviously right now you're dealing with a little bit of a stronger little bugger. So if I could ask, how what are you doing specifically to bounce back from this situation? Since we got Dr. Krueger here, maybe he can give you some insight on
Yeah.
things that have worked.
Yeah, for sure. I actually ate my breakfast in the sun, so with my eyes mostly closed because I'm just feeling really lethargic. But still, like I'm apart from a really bad headache that's now dissipated overnight. 2 days of headache. I'm feeling much better in myself. It's an unknown territory for me. I live rurally in a very, very large state that is sparsely populated, so I haven't, I guess, known much about how the infection goes through each day, what the pattern is. Not that I want to set expectations on myself. Like maybe if I don't know, then hey, I'm going to be doing a jog this afternoon.
Yeah. I mean, I think the biggest thing you said is like, I don't have too much to add other than like the stuff we talked about. Like, the biggest thing we have is that resiliency side of things and the bandwidth of operating. I think Johnny, we talked about it before it was recorded, but that ability to maximize your windows of adaptation is going to be, I think, some of the bigger things. Like you can never really truly prevent any type of infection or virus or things like that, but we can mitigate the ability or the severity through, like we talked about, the heat exposures, the cold exposures, optimizing nutrition, sleep, resistance training. Like there's so many things down the list that we haven't checked off with a lot of people that I think are warranted from, non-pharmacological sides, which I can't really delve into, but those are all the things that we can kind of hedge our bets towards, either, low rates of severity of a viral or any type of bacterial infection. And that's really how I look at it with people, is like, how do we shift your probabilities towards favor versus disfavor on that side?
Would you say in situations like this, using Nani as an example of an individual that, is always positive,
is going through something like this and she understands, maybe I need to shock my body.
Mhm.
Do you recommend, obviously, a sequence or a progressive sequence of introducing shocks to the body so that we can start to improve our immunity levels through sirtuin activation, such as, changing the way that our genes are activated based upon the environment, right? Epigenetics, this
Mhm.
can immediately have a direct influence on the individual's not only mental state, but hormonal, and at the end of the day, endocrine system.
Yeah, I mean, I think that's coming down to, like you talk about, like there's things in the literature of like vibrational sound waves, like 200 hertz ish around there.
Yep. Okay.
Is a big one on that side. I have learned a lot from just one of the great books that I read is actually from one of my mentors, Jonathan Pope, and Craig Weller. It's called Building the Elite. They work a lot with military special operations, and they talk about like the amount of psychology and in the role that plays and how people can have genetic output, in the sense of, like you said, how you believe in self and how you believe in adversity and how you build through adversity is such an epigenetic factor, because that's literally what special operation training is doing. Is it's selecting those that are resilient enough to do the tasks that are required of them. That's not saying everybody in here needs to be a special operator, but it shows the amount, like you said, of the ability to have reflection on self and self-worth, and understanding outlooks on how we can move through adversity can influence it. The sound, like we talked about, any type of nutritional profile, are all going to have an ability to shock the system. I mean, the biggest one that I use a lot is sauna. I don't think it's a miracle cure, but like you said, the upregulation of heat shock proteins, changes in telomeres, are all great ways that we can start to shock the system. But I'm always of the mindset, like, you're probably not going to take too much change in the moment. It needs to be something that you have already doing or are going to implement after said thing, because a virus like is just going to run its course no matter what we do. It's the reason why there's no way to cure a virus right now, because it self-replicates, it adapts. But we can do all those things where the body can learn from that virus, and it can kill it. It can help things that aren't, when it self-adapts or mutates, it has better defenses against it. So that's kind of how I look at it, is how do we set ourselves up for the next one, or the one after that. And I think that's when you can shock that body over time. And our bodies are smart. Like, you have to do that over time.
No, you're totally right. And actually, you just made me think of something else that could probably really benefit the conversation, especially directing it towards Nani's sometimes not very consistent sleep or restful sleep. I think you were addressing. Have you tried binaural beats, Nani?
No, not this week. I mean, I'm familiar in the past, but is there particular frequency you're thinking? Because I got time on my hands.
I guess you know what? And then this is kind of why I wanted to bring it up here with Dr. Krueger. It's the idea of, would this be maybe kind of like, and this is where I always go back to when people say how to meditate, right?
Mhm.
Because when they go back to let's meditate, well, we got to also define the why meditate.
Yep.
And then some people kind of overlook that meditation is that fine line between delta brain waves and theta brain waves. And sometimes the duration of a meditation actually has the most impact, is also what I've been able to kind of come across. Is there a specific period of time that you recommend individuals to listen to binaural beats?
I found, for me, like, my sweet spot is between 20 and 30 minutes. But I haven't seen anything with a direct number. You might have one. I just use, like, I think I have a binaural beat app on mine where I just use a 200 and a 203 hertz wavelengths on alternating to create a 3 hertz difference.
Got it.
Just enough to create that because really a binaural beat is just enough difference in the wave to create that alternating, like, do 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 do.
I love it.
So that's really all I do from that side. And that's when I, like, if I'm meditating, I use just a binaural beat because it helps me focus on something. I don't know. I go back and forth on the meditation and sitting in nothing. I like having at least a beat that I can focus on instead of like a mantra, because it just helps me stay focused on something. And that's why I like NSDR, because it calls you to focus inward without trying to focus on nothing. And that's just what's worked for me. Like, I know there's other individuals that say you really have to work towards the focus on nothing, but I think it helps me kind of center my thought by having at least something to either draw inward or something that is like non-simulatory, like a binaural beat. So I usually say something like a 3 to 5 hertz difference in a sound wave. Usually that 200-ish mark is been shown to kind of help induce some of that parasympathetic side of things, which I've found most helpful.
Well, that's a super helpful information. What do you think, Nani?
Yeah, I'll give it a try. I'm also going to do a yoga nidra session today. It feels inspired from this conversation.
Do
There's
it.
one that's my absolute favorite. It's known as Sleep of the Yogi,
Okay.
by Tanis Fishman. She's an awesome guide, but it actually it peels back the layers. So there is this initial focus inside, but you're peeling back the layers, and within that there's a practice of equanimity, which is a beautiful way of establishing resilience and balance to the polar, that we're born in this. Anyway, so but then in the end there's just this state of the body being fully at rest, fully asleep, but the consciousness being very, very wide awake. And and hence they call it sleep of the yogi. It's a practiced thing to actually stay awake. Many people fall asleep during yoga nidra, but to practice it to the point where you can reach that state, it's quite bliss.
It's wild. I describe it as like floating. I mean, that's a big thing they talk about in self-hypnosis, is like letting your body float. I think once you can like feel that, like it is such a wild thing with yoga nidra on that side, once you can get to that state.
Yeah.
Have you gotten there before, both of you guys?
Yeah, it's taken me a while. I guess I try to do some form of yoga nidra or self-hypnosis pretty much every day, usually the middle part of my day. That's like my power nap, like 20 to 30 minutes of yoga nidra, or the self-hypnosis from Reverie is kind of the two that I use.
How would you guys compare that to astral projecting?
I have never done astral projecting, so I have no ability to go from that side. Maybe Nani has.
No, I'm not sure what the did. I mean, perhaps I'm not sure what the experience is. There's this practice that I've learned through David Lyon, which was it reminded me at the start of yoga nidra, and then the deeper I went, the more I actually felt every cell in my body, like and it got to that point of pure bliss. It was insane. The vibration was just blissful. I don't know how to else to. So it's different, but similar. But I'm not sure about astral projection. Sorry.
No, this is great. No, I definitely need to go ahead and more than ever now, I need to start applying some yoga nidra in my life so I can zen myself out some more between all that's going on right now, right? That we are obviously living through some incredible times, and we have to find a way to increase our own, human bio shield, so that way we can go ahead and re-energize those that maybe need a little boost. And even when we're down, we got to know how to turn it up and really increase that cell frequency. And thank you for joining us, Nani. I know sometimes you may be feeling down, but if you think that there's anything we can do, our energy is always with you. And hopefully whoever's listening to this, and if they needed some energy and they picked up some knowledge out of this, then maybe we can take the next step together. Obviously, the next fitness challenge or health challenge that we're going to be running will be in January. So if anybody actually wants to go ahead and sign up, you could visit healthbankdow.org. And if you need to get in contact with Dr. Krueger, as you can see, the website is here in front of us, thepursuitop.com. And it's outdoor performance. Obviously, that's what it stands for. Phenomenal presentation, Dr. Krueger. Thank you so much. Does anybody have any more questions or any thoughts before we close off today? I got to say, I'm excited for the next one. When do you think we could do this again, Dr. Krueger?
That's a great question. I was looking at for like our health support every 2 to 3 weeks on that side. I'm gonna see. I want to put this one together. The hormesis one's gonna take a little bit, but I think it'll be worth the time. But ideally it'd be in like 2 to 3 weeks time.
And would it be I think it's just so cool that you got the chance to go ahead and put this together. So we'll go ahead, and obviously I know you and Sean are running the wellness podcast on every other Sunday.
Yep.
So hopefully those of you out there who are looking to learn more about the way that Health Bank sees health, the way that our mentors are sharing health, and more importantly, the way that they're preparing to run their own Web3 businesses. This is the journey of evolution as you witness those individuals who are currently serving the community. They're trying to build a way not only forward for themselves, but also leave clues as to how you can follow in their footsteps. And that's one of the reasons why I really enjoy what both Sean and Dr. Krueger here are doing. They are literally brick by brick building the path forward for any of you who may want to become a healer in this blockchain space. The only way to do it is by getting your information out there, sharing with the world what you know, making sure that you can give somebody a chance to live a better life because of your knowledge. Ultimately, we are here to share this knowledge. And I think, Eric, you said it best. Everybody's chipped in to make you the man that you are with the knowledge that you have. And all you're doing now is making sure to give it back. And that's one of the main reasons why I really enjoy everything about you and how you operate. So is there any final closing thoughts that you may want to leave us with?
Not much. Like I said, thank you guys. Like I said, I'm gonna throw the shout out as always to you and Health Bank. Like I want everybody to do that challenge coming January, because everybody that's already part of it, whether you're doing the challenge currently or in the leadership roles of Health Bank, you have to do it. You don't have a choice. Like that's literally the biggest thing that drew me to this project is, everybody can sweep the shed. That's one of my favorite lines from the Rugby All Blacks, is like, everybody can sweep the shed. And that's what we're doing with blockchain, is you have to prove your worth. And I think that's such a powerful thing, because it's a shared struggle. And again, I'm grateful for everybody on this call. And I just wanted to thank everyone.
My man, this has been a pleasure. Everybody, thank you for joining us. Nani, Harley, Sean, thank you for taking the time. This video call will be over in the next 5 seconds. Look forward to seeing you in the chat groups, and make sure to look for this link inside. 3, 2, thank you guys.